Hi, everyone. Lisa White, IVF coach with IVF Manifesting a Miracle, here with our friend Dr. Greene for another clinical conversation. How's it going?
Excellent. How you doing today, Lisa?
Really good. Happy National Infertility Awareness Week.
Yeah, we got our orange on in solidarity.
We do. Yeah, so today's topic, you alerted me to a really interesting and sad article that just came out about a Colorado fertility clinic that was sued over laboratory failure. And we'll talk about that really impacted a couple in a major way. And I mean, just to know what to look for in clinics and how these clinics and labs are, what we need to be aware of. So things like this.
I think one of the key points that I would make to people is that, a key focus of advocacy is access to care. And many people focus on access to care as being the only advocacy related issue. But the reality is access to good care is really what the key to success is. And the point is, some people focus only on cost and they try to do things as inexpensively as possible. And when you do that, you're compromising in one of several ways. Either you're, hiring less qualified people, or you're using less sophisticated equipment, or you're not doing appropriate monitoring. And one of the things that's evolving in this field today is some people are talking about having non-fertility specialists performing egg retrievals and transfers. In fact, there's some centers where they even actually have advanced practitioners like, nurse practitioners or physician's assistants actually performing egg retrievals and embryo transfers. And other centers are sometimes hiring embryologists with little or no training to do things that they're out of their league to do. And then by driving the cost down, they're also increasing the number of patients that are going through at any one time. And that's the worst of all situations, that if you have an increased demand amongst people that are least qualified, that's an invitation for tragedies to occur. And you and I were discussing a local tragedy that occurred just recently, but really I think that more and more this is going to happen unless people realize that advocacy is an access to good outcomes and good care, not just to care itself.
Very much so. I would love to know just some key factors maybe that you could share for individuals to look for when they're investigating a clinic or a laboratory, just like some really key things.
Yeah, well, what's really important is I know for a lot of people that all they're looking for is how many stars somebody has on Google or whatever search engine they're using, but that's not a real measure of outcome. Right. We have today either the SART registry or the CDC registry, where patients can actually look up a clinic's actual pregnancy rates and live birth rates. People can also look and see what the multiple pregnancy rate, incidence is, because centers that have high incidences of triplets and quadruplets, that's equally tragic for different reasons, and so what's important is part of self-advocacy is not just looking for access, but look for outcomes. And I'd recommend people look at either SART registry or CDC to see what the outcome of a center is, because that's the one way of trying to summarize the equipment and the quality of care that people are receiving at all levels of patient interaction.
And SART, how do you spell that?
SART is S-A-R-T. It's the Society for Advanced Reproductive Technique. And the acronym is SART.
Okay.
Yeah.
Wonderful. And I mean, thank you for sharing those resources. Are there any other websites? I mean,
yeah, there's some, aftermarket websites you could also look at. You could look at places like Fertility IQ. There's also IVF success rates. These are other people that really go into the original data pool of SART or CDC. Okay. And they try to make it more patient friendly. They use more charts and graphs, and these can be great as well. But it is important to point out that for some of these aftermarket centers, some centers could actually, purchase, trying to get more views and things like that. And so it's just like the search engines that people are using through, Google or Yahoo or whatever, a certain amount of what might appear to be a more popular center, you could actually purchase a higher ranking on some of these things, and it might not measure the outcome. And that's why going to the original data set for people that are willing to look at hard numbers without all the bells and whistles, that's where these other centers are getting their numbers from.
Okay.
And then also, as a patient, feel free to ask your doctor, are you a board certified reproductive endocrinologist? What is the experience of your endocrinology team? Do you have an on-site PhD endocrinologist managing your lab? Because you might be surprised to learn that the person that's managing your care is an OBGYN that has no subspecialty training, or might even be someone that's not an OBGYN.
Yeah, I mean, our embryologists are really the first babysitters, right?
They absolutely are. And so feel free to ask questions, and don't be shy about being specific, because for the centers that are high performing, for the people that worked for their advanced degrees, they're happy to tell you their qualifications. If someone doesn't want to share their qualifications, that might be a red flag.
I'm really glad you brought up the lab, because that was what the situation was for this couple from Washington. And they had 7 viable embryos. And within 48 hours, they went from just excitement and joy to heartbreak. And reading that article.
And what attracted them to get on an airplane and fly from Washington to Colorado was inexpensive access to IVF.
And this was in Colorado.
And yet they didn't even consider their travel expenses to be something. But the reality is, this is what happens is if you travel for the bargain deals, you're going to get the bargain treatment.
So that was just something I want people to be aware of. I mean, it's the double checking. It seems so basic, the lack of oversight.
Double checking would be, nothing compared to what we actually do.
Yeah, what do you do? Triple, quadruple, how many checks?
Yeah. Well, I mean, to be honest with you, at every level, we have multiple checks in place. And a lot of things that we do today include things that are automated, so that we have computers supervising the human checking as well. And so it's a backup, and then a backup to the backup, and then a backup to the backup as well. And these are the things that keep centers out of the news. And when people are not in the news, that people don't realize that that's a good thing.
Exactly. Yeah, we don't want to hear these stories, and sadly, we're hearing more and more of them.
Yeah.
Yeah, so just something so simple, right? These embryos were not provided the solution that they needed to thrive.
Yeah, just to give you an idea of what a simple technical error this was, and that normally with each petri dish, you put a special layer that's an oil-based layer on top of the media, then you place a cover, and then you place that back into an incubator that has a well-controlled humidity level. And a breakdown in any one of those steps, because it's a step and then a backup and a backup to the backup, what happened in this center is that those embryos were not protected, and the media dried up and the embryos died.
7 of them. I mean, that's heartbreaking. Absolutely heartbreaking. I cannot even imagine. So just word to those who are on this path. I mean, really know the clinic and the reputable clinic, laboratory, double check, triple check. I mean, this is so unfortunate. And I just hope people really take a serious look, at like making sure things are
maybe if it helps, the viewers of this, one of the things we could do is, when you post this, you could even post a link to the story for
Yes, I will share the story.
Yeah, so that people can understand the way that this was covered by the news media. But unfortunately, the center that this happened at, that's an outlier. And but then the immediate backlash is they're saying everybody needs more supervision. And the reality is, you don't fly a no frills airline and expect all, all the special treatment as the people in first class. And what we need to do is find that everybody has a certain degree of safety and try to find that happy medium, because people shouldn't have to pay the top dollar, but also going to the bargain basement is not good either. There's a sweet spot in the middle where you could optimize success while you're also minimizing the expense. And that's what's really important, is improving access to good care, not just improving access to care.
Right. Well, I'm so grateful that you shared this with me. I mean, this is just so important for individuals to be aware of. And thank you for all the good work that you do.
Absolutely.
Sorry for the noise.
Thank you for getting the word out.
Of course. Yes. Connect with me at IVF. We're getting a new kitchen, so apologize. Wrapping up. You're at enhancingfertility.com. I'm at IVFmanifestingamiracle.com.
Stay happy, Lisa.
Bye-bye.